Non-communicable diseases, the silent pandemic of our time. Across the world, and here in Nyeri County, these chronic illnesses are rising at an alarming rate. Their effects far-reaching and devastating. In Nyeri, NCDs related cases account for half of the hospital mortalities. Families continue to struggle under the weight of costly treatments. Communities face reduced productivity, and our health system strains under the increasing demand for long-term, complex care. But amid these challenges, a solution is emerging: strategic partnerships. Recognizing the urgency of the NCD's burden, the County Government of Nyeri, through the Department of Health, has joined hands with dedicated partners to roll out impactful interventions. From preventive approach, strengthening facility readiness, capacity building, and policy planning. In 2024, PATH Kenya formalized a partnership with Nyeri County Government to implement a comprehensive NCD project focused on cardiometabolic diseases, diabetes, hypertension, obesity, and dyslipidemia. The project is operational in 40 health facilities across all 8 sub-counties, 6 Level 4 hospital, 26 health centers, and 8 dispensaries. At Endarasha Health Center, facility in charge Stephen Lacharya shares how PATH's intervention has transformed patient follow-up.
Indeed, there is the support from PATH in collaboration with the County Government of Nyeri, whereby those NCD patients, previously, we used to review them using their booklets, but sometimes it was difficult because a patient might lose their file or their exercise book, their patient card, and then you don't know the real follow-up of the previous visits. PATH came in, and we really appreciate them. They introduced the patient files. They also introduced digital health platform, whereby we document the information, the patient's data, including the vitals, as well as the blood sugar readings in that platform. It becomes easier even to make a follow-up because you're able to follow up with this patient. The previous visits, his or her readings were this. This visit, the readings are this. So you have that real-time data.
For community health promoters like Peter Macharya, the impact is felt right at the household level. PATH support has strengthened NCD clinics by supporting over 8,500 patients enrolled for monitoring and management and introducing both manual and digital data systems.
PATH International walitusaidia sana kwa community sababu huyo muda walikuwa wamepeana, tuliscreen watu wengi sana katika community na watu wakajitokeza. Tunashukuru watu wa PATH International kwa kutupea hiyo support walitupea, ndiposa tuweze kusaidia community zetu.
Laboratory capacity has been enhanced with equipment like total cholesterol analyzers and HbA1c testing machines deployed across multiple facilities. These investments ensure accurate diagnosis, better management, and continuity of care. Across Nyeri, PATH has facilitated the formation of NCD support groups, safe spaces where patients share experiences, learn coping strategies, and walk the journey together. Peer support remains one of the strongest pillars in empowering communities to manage chronic conditions.
We have been here in Nyeri for the last 1 year and some few months, and it's a project that we are implementing in the whole county. For us, we have 40 health facilities, including 6 level 4 hospitals, 26 health centers, and 8 dispensaries, making it a total of 40 health facilities here in Nyeri. In the data management aspect, we have implemented a digital platform whereby we are digitizing the NCD registers, and we have also provided the facilities with physical files. All these anchored to achieve the data management system. Recently, we have done a mass screening exercise whereby we have screened more than 45,000 residents of Nyeri County, purely the residents who don't know their status in terms when we talk of diabetes and hypertension. We also have a special program whereby we empower the physicians, and we have what we are calling the InReach, whereby the NCD clinic in the lower level facilities, like what you have mentioned, the primary healthcare networks, we do what we call the filtering of the patients. All the patients with the more critical indicators for the NCDs, we filter them and schedule for a date with the physician, whereby we visit for the review at the lower side of the healthcare system. And we believe one of the outcomes will be that we shall decongest our level 4 hospitals and the level 5 hospital through this approach, whereby all the services that you need to be offered at the higher level will be offered with the assistance of the physician whenever we have the InReach at the lower facility.
PATH Kenya acknowledges the unwavering support of the County Government of Nyeri under the leadership of Governor Mutahi Kahiga and the Department of Health Services in this bold step towards strengthening primary health care, ensuring that every household in Nyeri has access to quality, continuous care.